Hi, I'm Dr. Emily Park with your Functional Health Minute for today. Today, I would like to talk to you about gluten and the potential health risks that can happen if you do have celiac disease or non celiac gluten sensitivity. And we will talk about the differences between the two. But first, let's talk about what is gluten. Gluten is a protein in wheat, and it is a relatively large protein, and it is more difficult for the human digestive tract to digest. So there are some people that have a sensitivity to gluten that don't have celiac disease. So celiac disease is an autoimmune disease of the small intestine that happens, that's triggered by eating gluten. And so what happens is the small intestines get very, very inflamed, and you get what's called blunting of the villi. The villi are the little fingers that are in the small intestine that help, they're very they have a large surface area, and they do help with nutrient absorption. So what happens when you have celiac disease, the small intestine gets inflamed, and what happens is all that surface area gets blunted. And so by blunted, it means like all of it closes up. It's so inflamed that the surface area for absorption has now decreased. And that does lead to, of course, symptoms of diarrhea and, malabsorption of nutrients. So you're going to see some nutrient deficiencies and fatigue and potentially anemia and things like that. So that is celiac disease. But then there's a whole category of non celiac gluten sensitivity, meaning you do not have celiac disease, but you get a symptom and you don't feel well when you actually eat gluten. And the symptoms can be anything, by the way. They don't necessarily have to be GI tract, but certainly, when you eat a food, it makes you think, okay, is my stomach upset? Do I have diarrhea or constipation, even gas and bloating, stomach cramping, heartburn or acid reflux? You, of course, think of the GI symptoms first, but it can be any symptom from head to toe because there are different areas specifically for gluten that get attacked more commonly than others. So there's three different main categories. There is, of course, small intestine, like we discussed with celiac disease. Then there's skin, and then also brain. And these are tissue transglutaminases 2, 3, and 6. And so those are the specific um, antibodies that can get turned on that can create symptoms in patients that don't necessarily even have celiac disease in the case of 3 or 6, but they may have skin manifestations or they may have, brain and central nervous system manifestations when they eat gluten. Then there's, a gluten intolerance. And so, they don't have more serious manifestations that I was just telling you about, but you might get headaches, or, you might get fatigue, or you might get some, mild bloating, or you may retain water. There's some sign to your body that it might not be a great food for you. So, can, everyone eat gluten, or should everyone eliminate gluten? And the answer is, truly, not everyone has to eliminate gluten from their diet forever. If you are perfectly healthy, you don't have an autoimmune disease, you don't have gut symptoms, you don't have any other symptoms, your digestive tract is working beautifully, can you tolerate gluten or wheat? Sure, you can. That, and we've proven that. There was actually a recent study that just came out that looked at healthy volunteers doing a gluten versus gluten-free diet, and they didn't have there's no difference in symptoms. But the patients coming to seek out functional medicine, of course, have some symptoms. So what I recommend is just do an elimination trial, right? Eliminating any food from your diet for 30 days is certainly not going to be harmful and potentially helpful. And I have done previous videos on, what food sensitivities, allergies, and intolerances are, and, how to properly do a food reintroduction. You can kind of go back and look at those if you're curious and you want to try a 30-day gluten elimination for yourself. So I hope this helped shed a little bit of light on the topic of gluten. This is Dr. Emily Park with your Functional Health Minute for today.